Uh, I had I was diabetic from the time I was 10, and I was diabetic for almost 25 years, and then I suffered kidney failure, and so I had a kidney transplant. And at the time, they were doing kidney pancreas transplants. They were very big on that and having a great deal, over 85% success with the kidney pancreas transplant. So I had that in 1995, and it was a huge success. And suddenly I'm no longer diabetic. Wow, great, great thing. Definitely a change of life. Uh, but a transplant is major surgery. So you've got this big incision and you've had surgery. I didn't have any trouble, but a year later, after the transplant, I had to have an appendectomy. Went to the emergency room and they were concerned that I was having rejection of the kidney, but when they ran my blood work, it showed that the kidney was fine, but my white count was raised considerably, and I even suggested to them, and they don't like that. I said it could be my appendix. Two or three of my siblings had appendicitis and had to have the appendectomy. So they wanted my surgeon that had done my transplant to do the appendectomy. He was doing a transplant right at that moment, so I had to wait several hours at the hospital in the ER. By the time he was ready for me, the appendix had burst, had ruptured. So, as he said later to me, it was a terrible mess once he got inside and opened me up, and that appendix had ruptured, and so he took it out, and they got that taken care of. So that was operation or surgery number 2, as it were. Then, years later, in 2008, I was told I had been on immunosuppressant drugs from the kidney pancreas transplant. So I had been on immunosuppressant drugs for all those years, and it had caused me to get non-Hodgkin's lymphoma. And so that's when I was first began having bowel trouble, bowel obstruction. And I had a CT scan, and it showed that there was a mass in my intestines. So in the fall of 2008, they took me in, admitted me to the hospital, and took it out, did a bowel resection. Amazingly, the kidney and the pancreas were still working. They had to considerably lower my immunosuppressant dose because of the cancer. So they did a bowel resection. They took out 18 inches of small bowel. And I had a fairly quick recovery. I did have a series of chemotherapy over the next 6 months, once every 3 weeks for 6 months. Chemo is hard on the body. It's but it took care of the cancer, and I haven't had any reoccurrence of that since. So the bowel resection in 2008 was the third operation, or the third time they'd opened that incision. So I started having recurring trouble with the bowels in 2010. And in talking with different health professionals, I found that they thought I probably had a bowel obstruction or adhesions coming off the incision from all my surgeries. But the strange thing about it was objective to the solution was have another surgery. It was my brother that found Clear Passage online, and he called me and recommended, and he said, there's a place in Florida, Gainesville actually, that takes care of adhesions and bowel obstructions by doing a type of massage. And I thought, this sounds really, really interesting. So in August of 2010, I contacted you guys at Clear Passage, and that was the first time I came out. I stayed for a week and had therapy each day and began to see immediate results. I'm one of those people, unfortunately, that all my stress goes right to the gut. and boy, do I feel it. As soon as I started having therapy, it was so nice. My muscles in my abdomen, in my stomach started to relax. And within a few weeks, the bowel obstruction was gone. My bowels were back to normal. Yeah, that was wonderful. The therapist gave me suggestions on how I can do therapy. You know, I'm not a physical therapist. I'm not a massage therapist. I didn't think I could do any of this, but the therapist here gave me wonderful tools that I could self-therapize. If that's a word, we're going to use it. And it allowed me to do some therapy when I was feeling tightness in the gut area.